Thank you very much. It is indeed an honor on behalf of the tripartite group to present this statement. It seems entirely fitting to present this statement at a seminar entitled The Medical Profession in the 21st Century. As we were setting up the tripartite group, its working arrangements, etc., we were trying to decide on exactly what would be an appropriate topic to discuss, and the one that came up time and time again was indeed the issue of professionalism. I'm going to go very quickly through some slides, but we'll give you the references. The group decided that we, in fact, needed to work on a definition, come up with a definition that we would agree to, and the definition that we used was that of the cruises, which was published in Academic Medicine in 2004, and it outlined that we are in an occupation whose core element is the mastery of a complex body of knowledge and of skills. It's governed by a code of ethics, and all three colleges have those. There is a commitment to the maintenance of competence, integrity, morality, altruism, and the promotion of public good within the domain. Additionally to that, this is the formation of the social contract. The elements that we based this on were informed by the Honorable Jeffrey Davis's article, which was published in 2011, where he outlined that the duty individually and collectively is to put the interests of the patient ahead of those of the individuals. Based on these, our statement reads that traditionally the characteristics of medical professionalism involve a duty to patients. It embodies professional competence and performance, which includes, but not just includes, not exclusively includes, there are other elements, but the important elements that we chose to put into our bullet points are the honesty and integrity, the confidentiality and responsibility to the patients, altruism, and respect and compassion for our patients. The context within which this is practiced in the 21st century has changed since some of these elements were described. Yet, in fact, the importance of the elements have not changed. There is, however, increasing societal expectations of the profession. We've had advances in technology, which mean we need to address issues in a somewhat different fashion. There are changing models of care from those practiced traditionally, and indeed we are all having to address issues of constraints within the system. The contemporary medical professionalism must also include demonstration of continuing professional development and lifelong learning. We need to maintain patient confidentiality and professional boundaries within increasing ease of access. We need to demonstrate clinical leadership, including health advocacy, intra- and interprofessional communication and interactions are of paramount importance. We also have the responsibility to maintain as a person our health and our fitness to practice and know when we've extended beyond that. We also, again, espouse a collective duty to meet societal needs. We need to stay current because context of practice is changing. There are a number of internal and external factors that influence our performance. The use of professional development tools, including frameworks that all of the colleges have that describe professional behaviors, will assist doctors to enhance their performance. And the attributes of professionalism and their application to medical practice require continual renewal and review so that we do stay up to date. Finally, our concluding statement is that in the 21st century, the characteristics of medical professionalism continue to be applicable to all doctors and are grounded in the duty to individuals and to society. So this is the statement that we would propose as a tripartite group, and I think now we'll hear from each of the colleges as how they see this being applicable to their specific domains.